Hello, my name is Eric. I'm a student physical therapist assistant with CBD College, and today my patient is a 50-year-old woman who has signs of degenerative joint disease and has pain on her lower back, along with some tightness on her hip flexors and TFL, and also presents with lordotic posture. Based on the Owestry Disability Index score, this patient is on stage 3 because she scored a 12 out of 30, and stage 3 will be a score less than 15. This patient will require more strength, endurance, and work-related exercises. She also has a 4 out of 5 strength on her abdominal muscles, and lumbar motion is reduced by 25% in all motions. So the best action for this patient is to work on activating the trunk with some isometrics. Also do a spinal stabilization 3 to 6 for hip flexor and abdominals to work on getting more of a posterior tilt. And lastly, work on spinal stabilization for the erector spinae for the low back pain. Working on these 3 exercises will help this patient because it will strengthen the core muscles, which help her have a more posterior pelvic tilt since she has a lordotic posture. It will also reduce the low back pain and stiffness in her core surrounding muscles. So now I will show the 3 exercises that I will have the patient doing. Okay, so now I will demonstrate the 3 exercises that I will have the patient do. So the first exercise will be to work on the rectus abdominis. So I will have the patient on supine, and then she will bring her hip up and down for 3 sets of 10 reps. So it will be something like this. Like that, and then bring up, down, up, so she will bring her leg up and then down. So it will be 3 sets of 10 to work on the rectus abdominis. Then the second exercise will be for the erector spinae. So the patient will be on quadruple and then bring her one leg and then one arm at a time. So something like this. So that will work on the erector spinae muscles, so it will be for the low back pain. And if that's too hard, maybe just bring the leg up and then the other leg instead of doing the leg and the arm. And then the last exercise will be an isometric for the trunk muscles, which I will have the patient on supine and then have her hold something like this, and then the patient will try to hold my resistance. So I will try to push up, down, side to side, and the patient will just try to hold it. So something like this. This, resist me, resist, resist, resist. So the patient will try to resist all the motions that I'm going to push, and then the patient will hold those positions for 10 seconds, and we will do it for 10 reps to work on the trunk stabilization muscles. So by doing those 3 exercises, I will have the patient work on the rectus abdominis, then I will have her do erector spinae for the back, and then trunk stabilization isometrics for the trunk. So hopefully that will lower her pain and it will make her less stiff, and then it will fix her lordotic posture by working on getting a posterior tilt on the pelvic. And then I will also educate the patient just to have a more natural spine when standing or sitting, so hopefully that will decrease the pain also.